What's up? I'm Hutch, and you need to understand cerebrovascular accidents so that you can better treat your patients and also pass the NPTE. A cerebrovascular accident, or a CVA, also known as a stroke, occurs because of decreased blood supply to a region of the brain. This causes decreased oxygen, which then causes that tissue to die or become significantly damaged in the time until more blood flow and more oxygen can get in there to supply it with nutrients. Now, this can occur through a blocked artery, an embolus or thrombus, as well as increased pressure on those vessels to decrease the blood supply to the brain. Every CVA is going to look a little bit different, and I've made a few other videos on this just in case you want to look back and review the functions and structures of the brain. Now, it's really important to identify a stroke as fast as you can. And so they've come up with a mnemonic called Be Fast to help you identify those symptoms. Your balance will worsen, your eyes or your vision will get a little bit blurry, your face usually droops on one side, you may have weakness in one or both arms, slurred speech, and the T says that it's time to call 911 if this occurs. Now, this is really important, again, to do it as fast as possible, because if you can get to the hospital and have a TPA treatment within about 4 hours, then usually you can reverse a lot of the symptoms of a stroke. A TIA, or a transient ischemic attack, is basically like a mini temporary stroke. Now, when doing an evaluation on a patient with a stroke or trying to predict kind of what you're going to see, the hemisphere of their stroke makes a big difference. For example, the left hemisphere controls language, logic, and laughter or positive emotions. Typically, people that have a left CVA will have right hemiparesis, as well as be a little bit slower and cautious about things. The other hallmarks of a left hemisphere stroke include agnosia, aphasia, and apraxia. The right hemisphere controls more the arts, the negative emotions, nonverbal communication, and spatial relationships. So here you'll have left hemiparesis as well as more impulsivity. And then your hallmarks are pragmatics issues, pusher's syndrome, and perceptual neglect. In perceptual neglect, you're going to kind of ignore the left side of your body usually. And in pusher's syndrome, you're usually leaning a little bit more towards the left. Now, I'm just going to review a few really common, more specific symptoms that you may see in your patients with a stroke. Dysphagia is difficulty swallowing. Dysarthria is slurring of the speech. Again, one of the key symptoms that you'll see pretty quickly. Hemiparesis is one-sided weakness versus hemiplegia, which is one-sided paralysis, which is a little bit less common. You'll see that more in patients with like a spinal cord injury. Perseveration is repeating words or acts without having a cause to do so. Pragmatics is more like unspoken communication, so like facial expressions or the tone of your voice. Agnosia is a decreased ability to identify objects or sensations. Apraxia has a bunch of different categories, but the main idea is that it's difficulty getting a plan in your head to come to fruition with your body. So in ideomotor apraxia, you can plan, but you can't volitionally perform tasks. So you'll need indirect cues, like if you want to get your patient to touch their head, you may have to say, hey, can you brush your hair for me? In ideational apraxia, your patient has decreased proprioception, which decreases their ability to plan and sequence. So they need a little bit more visual feedback. In constructional apraxia, they can't recreate patterns to perform a task. And in verbal apraxia, they can't motor plan for speech. Another really common symptom of a stroke is called aphasia, and this is difficulty with communication. And again, there are several types. In fluent aphasia, this is also called Wernicke's or receptive aphasia. Your patient has decreased comprehension, but they're able to speak just fine. But because they're not really able to understand anything, the words come out kind of disjointed and they don't really make sense, and your patient ends up kind of babbling. With non-fluent, aka Broca's or expressive aphasia, they can understand everything, so their comprehension is there, but they can't convert their thoughts into words in order to communicate. And so they end up being really, really frustrated because they understand everything but just can't respond. And then global aphasia is difficulty communicating and comprehending even though their intellect is perfectly okay. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. Again, strokes will vary significantly because each will affect structures in a unique way, but these symptoms are fairly consistent with individuals that have a stroke on this side. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or you can comment with questions or suggestions for videos I should do in the future. Otherwise, good luck studying. Go change the world.